So you've got a scared and hurting child in your chair. You've got him calmed down. And the next thing that we're going to do is we're going to try and put the piece of this tooth that was broken off onto the tooth. Now obviously the tooth will be in the mouth, but for teaching purposes it's kind of easier to do it this way. So the first thing you want to do is you want to make sure that this tooth piece and the tooth that it's going to attach to approximates. And what that means is we want to make sure that there is enough tooth structure that we can actually bond it to the tooth, and we want to make sure that it fits properly. So we basically try to line it up. It might approximate perfectly, or it might have a little gap. Sometimes it does, and if it does, that's not a problem if it has a gap, because we're going to be actually using composite to glue these pieces together. So if it doesn't fit 100%, we aren't too concerned about that. So let's go ahead and do that. First thing that we do is we clean off the pieces, make sure that there's no debris on the pieces, and then you can use several different things. You can use hydrogen peroxide, you can use saline to clean it off. You just don't want any debris on the tooth or the fragment. So the first thing we're going to do is we're going to etch the tooth, and I go up the crown on the facial. It gives us a little bit more retention for later on when we try to make this a little bit more aesthetic. And then I just go around the tooth and make sure everything is getting etched. Then, again, this would be in the patient's mouth, but we're going to do it this way since this is simulation. Then we're going to take the fragment and do the exact same thing. So we're going to etch the tooth and put it on a separate. There we go. Okay. Now, before we do anything, we'll rinse this, and we'll want to make sure and really hold on to the fragment so it doesn't get sucked up in the high evac. So we'll go ahead and rinse it, and then we're going to make sure that we don't drop. Okay, so now we're gonna rinse off the fragment, both sides. Okay. All right. And we'll put it on a dry. And then we're going to do the same thing with the tooth. Rinse it off. Okay. So we have a clean tooth and a clean fragment. So we're done with our etch. And granted, you'll be working with an assistant when you do this, so it won't be quite as messy as this. But so what we want to do is we really want to make sure that this tooth fragment goes exactly where we want it to go, not down the throat or in the trachea, and we end up with an aspiration situation. So we're going to take a bender brush and we're going to bond it to the tooth. So here's our prime, and I usually do it on the front or the front of the tooth. We're using the piece. We're going to bond the piece. So I usually do it kind of right on the edge. We're going to eventually be adding some composite to this area, so we want it to be pretty aesthetic there. So we'll try kind of. Okay, so we've thinned that out. Now we're going to light cure it. I'm gonna take a little bit more bond. And whatever bonding system you have, you can use. So I'm gonna ask my assistant to cure this so I can hold it, so, thank you, Mama. And we just basically want to bond this to the tooth. Okay, so now you've got the tooth fragment. It's secured on the bender brush, so when you are approximating it, you don't have to worry about it falling off and the patient swallowing it or aspirating it. So I'd really highly recommend that you try to do this, because in the mouth, especially on a wiggly patient who might be scared, it could be easily swallowed or aspirated. The facial surface of the tooth, we're looking at it's approximating really nicely, very nice approximation. Sometimes you get these that are just beautiful and other times you don't. So we're gonna go ahead and go with this one, and we're going to apply our flowable composite. And then we're gonna take our tooth piece and we're going to approximate it, kind of looking at all angles before you spot whip. Make sure to wear your safety goggles for this because you don't want to burn your retinas. Always wear your composite glasses. Okay, so there we go. We've got a nice approximation there. So what I'm going to do now, a lot of times you'll have to add, and when I kind of move my finger or the Explorer over this, there's just a tiny little catch there, but that's the composite. We'll get rid of that when we do our polishing. And you'll see there's kind of a bulge of composite right there that kind of squirted out once we approximated the tooth. We'll also get rid of that. So now what we can do is we can pull the bender brush off of the tooth and we'll polish. Now, if you have a lot of composite, you may want to use like a football finishing burr to get the bulk of it out. If you don't have too much, just go right to your sandpaper discs or whatever polishing system you have and kind of get off the extra first. Just want to get the bulk off. And you can still see the fracture line. And keep in mind, these are acrylic teeth, so it actually looks better on a real tooth. You want to get the little blob of composite that you had your bender brush on, and again, you can take that off with, you know, a flame finisher or a football finisher, whatever you've got. And basically, you just kind of go around the tooth and you kind of get it nice and smooth, and you'll be feeling it with your Explorer to make sure that you're not doing catching any composite or any ridges. Now sometimes this tooth approximated almost perfectly, but sometimes you'll have little fragments that might have fractured off during the fall. So you might have a little hole in the back or hole in the front that you have to fill in with composite, and that's fine. Now keep in mind, you know, this is a fractured tooth. We're re-gluing it on. There's going to be a fracture line, but if we can mask that as best we possibly can, it's nice. This is a really nice option for kids, especially kids who are pretty anxious and who wouldn't sit for an hour-long composite buildup.